Oral cancer is one of the most devastating cancers that I see in my practice. But 90% of the time when I see these patients, the cancer is so advanced that their treatment options are limited. The reason being is because they didn't pay attention to the signs early on, and some of the signs are silent. They don't really notice it, or they just kind of brush it off. So in this video, I'm going to share with you 6 oral cancer signs that you should never ignore. Because if you catch it early, then there's so many things we can do to help you out. Welcome back to the channel, everybody. I'm an oral surgeon. This platform is created to help answer questions you have about oral surgery, the healing process, and help you make more informed decisions about your health. Please like and subscribe so you don't miss any new videos. Sign number 1 is lumps or bumps in the mouth. Now, this could be anywhere inside the mouth. It could be on the lip. It could be on the tongue. It could be on the floor of the mouth. It could be in between the teeth. If you feel any type of lump or bump that continues to grow, you need to go get checked out by your dentist. In the vast majority, it's going to be something benign, but there's still a small percentage that can be cancerous. And by getting it checked out early, you can treat it appropriately. Number 2 is pain with chewing or swallowing. If you're noticing that chewing or swallowing is becoming more and more painful, especially on one side, that is a red flag for oral cancer. Most people think, okay, pain means infection, inflammation, maybe a cavity, something like that. And while that could be true, persistent pain that doesn't go away after taking pain medication, a Motrin, Tylenol, something like that, you should go get checked out because that could mean there's something more sinister going on. So number 3 is difficulty chewing or swallowing. And this is a little different than the last one. This is more so if you're noticing that you're having trouble chewing or swallowing, but there's not really pain associated with it. It's just becoming more and more difficult. There's a lot of things that can cause this, but it could be a sign that there's a mass in the area that's starting to obstruct or block that passage. And again, if you're having difficulty chewing or swallowing, it doesn't mean it's cancer, but it could be something serious. So you definitely want to go get checked out. Next one is ear pain. A lot of times people will come in and they'll say, "Oh, my ear hurts." And you'll ask them, "Did you have your wisdom teeth removed? Did you have some dental work done recently? What happened?" And they'll say, "Oh, no, it's nothing. It's just my ear." But sometimes it could be related to something called temporomandibular joint disorder, or TMJ. And what happens is there's a joint right here. It's called the TMJ, or the temporomandibular joint. Sometimes when people develop arthritis in that joint, it can start to hurt, and that pain can radiate into the ear. And if left untreated, that can lead to oral cancer. So if you're having any type of ear pain that's not going away, definitely get that checked out. And number 5 is loose teeth. Now, I'm not talking about a tooth that's loose from like a sports injury or something like that. I'm talking about a tooth that was fine one day, and then the next day it's loose. Now, a lot of times people think, oh, it's just my tooth is getting ready to fall out. It's probably just a little wiggle and then it'll be fine. But if a tooth goes from being completely fine to all of a sudden loose, that's a red flag. That can mean that there's bone loss around that tooth, and that can be a sign of oral cancer. If you have a tooth that becomes loose for no apparent reason, definitely get that checked out. All right, so number 6 is white or red patches in the mouth. So a lot of times people will develop these patches in the mouth, and they can look white or they can look red. And if you see these patches, they might not be painful, they might not be doing anything, but that is a sign that you should get checked out. There's 2 specific types of leukoplakia and erythroplakia. Leukoplakia is where you have these white patches, and erythroplakia is where you have these red patches. And the key difference is that erythroplakia has a much higher risk of becoming cancerous. And both of these can be precancerous. So if you notice any type of patch that's not going away, you've tried some home remedies, it's still there. Definitely get that checked out. So these are 6 silent signs that you should never ignore. And there's a couple other signs that are very obvious that I wanted to mention. Any type of lesion that won't heal, like a wound or an ulcer that won't heal in the mouth, that's a red flag for cancer. Also, If you notice that your gums are constantly bleeding for no reason, that can be a sign of cancer. So if you're brushing your teeth and flossing and you're seeing blood everywhere, that's not normal. And lastly, if you notice that your gums are receding, that your teeth are moving, or that your jaw is starting to change shape, those are all signs of periodontal disease. Periodontal disease is actually a risk factor for cancer, so if you have bad gums, that can put you at higher risk for developing cancer. So those are 8 signs that you should never ignore. Now remember, just because you have one or more of these does not mean you have cancer. I wouldn't worry about it. I'm just trying to educate you guys on being aware of these signs because early detection is so important. It gives us the best chance of successful treatment. Now, I've talked a lot about the signs and symptoms, but what do you do if you notice these signs or symptoms? Well, first thing you need to do is call your dentist and schedule an appointment. If you don't have a dentist, go to the nearest urgent care or emergency room. If you notice any type of lesion that is growing or not healing, it's very important to get that checked out right away. And depending on where you live, you might be able to go to a free clinic. Here in Dallas, we have Parkland Hospital, where you can go and get care for free. Now, once you get to the dentist, they should do a basic exam, look at your neck, look at the inside of your mouth, take a little biopsy if needed. But in my opinion, everybody should get a CT scan. A CT scan is very helpful for dentists and doctors to visualize the inside of the mouth, the neck, the base of the tongue, the floor of the mouth, the lymph nodes, and that can give us a lot of great information to help guide our treatment. And if there is cancer, it can help stage the cancer. Staging is important because that helps determine what type of treatment is appropriate. Once you get the results of your biopsy, if it is cancer, the next step would be to figure out where is the cancer located, what type of cancer is it, and what stage is it. For example, I see a lot of patients who come in and they have cancer of the tongue, and the cancer is only in the tongue. Those patients have a great prognosis. We can do a full removal of the cancer, reconstruct the tongue, and typically those patients do really well. But sometimes the cancer has spread to the lymph nodes, and that changes the treatment plan. Treatment could involve chemotherapy, radiation, or a combination of both. I hope this video was helpful. If you enjoyed this content, please like and subscribe. If you have any questions, leave them in the comments down below. I'll try to answer as many as I can. Thank you guys for watching. Have a great day. Bye-bye.